I thought I'd just start off with a quote from Sharon, talking at International Workers' Memorial Day, April 28, 2015. And that was very much in the context of stuff that Peter talked about earlier, about the Rotterdam Convention and what's happening, about problems with us trying to even just decrease the trade in white asbestos. And also, just as an overarching comment, about perhaps to think about in terms of lobbyists and scientists. The key agencies that work around regulating our carcinogens, and both chemicals and others in this country, are those key ones at the national level. SafeWork Australia, NICNAS, the NPI, AgVet, Transport and TGA. This shows how they interact. That was done in 2012 by then the Standing Committee on Chemicals, which existed to implement the recommendations from the Productivity Commission inquiry into plastics and chemical regulation. That report was in 2008. SOC was set up in 2010. It's since been disbanded. That spaghetti diagram, as we tend to call it, and numbers of you will have seen it before, is really because our system has evolved from many different places, and so we've got multiple frameworks, we've got multiple agencies, we've got multiple stakeholders, and really each of those systems was devised for a particular grouping or a sort of audience of where things were to be regulated. As the Productivity Commission report said in 2008, our chemicals framework is fragmented and inconsistent. Our carcinogens framework is fragmented and inconsistent. That it's not just the chemicals. If we look at some of just briefly at the agencies, SafeWork Australia is a non-regulatory agency, but it does set the standards that are then adopted by the various state and territory jurisdictions. The important ones around chemicals and carcinogens are the model hazardous chemicals regulations that also include subsections on dusts, asbestos and lead, etc. Classification, prohibited and restricted carcinogens, which includes some chemicals and some dusts, and health surveillance. I was actually really pleased to see Megan mentioning about SafeWork Australia health monitoring guidelines. Those guidelines, in some ways, an example of our disjointed system. AgVet chemicals are actually covered by the AgVet system, and health monitoring comes out of the worker system, and really it's getting those two to meet. There are numbers of substances on the SafeWork Australia health monitoring list that the New South Wales work cover is picking up as workers need to have some health monitoring done. But generally you'll find that in the rural sector that health monitoring is not done because the SafeWork Australia guidelines are not really publicised in that sector. NICNAS was established in 1989 to cover all of those chemicals that were existing and then for assessment of new chemicals that came into the system. The thing about NICNAS is that it comes under a lot of fire from industry. It has been recently going through they're up to their 13th tranche of looking at assessments and updating information of all of those chemicals. About 40,000 of them were on the AICS list. They're looking at 3,000 of them and assessing their hazards and publishing that information and calling for public comment. And they have had been exposed to numerous and many reviews. I'm sorry, I do need to go back. I skipped. SafeWork Australia is in a difficult posse because it's not a regulator, it coordinates all the regulators. Our exposure standards list in this country ain't been fixed or looked at for about 20 years. Our health monitoring list hadn't been updated since it was put in place by NOSH in the early 90s. and we were really doing nothing on cancers. The positive things are that SafeWork Australia has, and at the moment has just hopefully making a decision in the next 6 weeks to update the list of substances that will require health monitoring. The National Occupational Cancer is actually part of the Australian Health and Safety Strategy for 2012 to 2022. Exposure standards, which have been mentioned earlier on today, are an interesting mix of where regulation around health and safety meets with what's called government better regulation, and I'll come back to that later on. The National Pollution Inventory, list of 93 substances, 1991. Some of those are carcinogens. That list hasn't been changed. That list hasn't been regulated. It's just an admissions list, and it's for stuff over 10 tonnes that comes out of our place. AgVet, veterinary medicines, their products are looked on how they're used. So the labels have traditionally been about using rather than the actual inherent qualities of the substances themselves. APVMA can review and restrict or ban. They do that very occasionally. We have been under perpetual review. This is just some of them. I started to look at all of the submissions that I had made over the last 5 years on chemical reviews, and I got totally lost because we're just like, there seems to be, I don't know, there's an AgVet one, we've done 2 or 3 of those, we've done 3 or 4 of the NICNAS ones, we've done productivity commissions a couple of times, we've done the Better Regulation Ministerial Partnership draft regulatory impact statement 2013, Commission of Audit. We're going to looking at what we can do about NICNAS, SafeWork Australia and AgVet. And now, last week, we were contacted and had yet another lot of discussions about structural strain in Commonwealth chemical assessment functions. They are going to do the whole of what we do around chemicals, and the report's going to be done by September this year, and you can't find the terms of reference publicly, and that is in the context of an Australian Government Guide to Regulation, which says that regulation is introduced as a last resort, regulation hampers the economy, and we look forward to a future with substantially less red tape. I have not changed those words. They're what in the Government Guide to Regulation. So how does that impact? It means to change an exposure standard in this country. SafeWork Australia has to go to the Office of Best Practice Regulation and get a regulatory impact statement done for the cost-benefit analysis about whether or not a change in an exposure standard is effective on terms of meeting the requirements of the Australian Government Guide to Regulation. It means it's bloody hard to do. It means that the lead exposure standard, which is there since 1994, which all of the scientists say we need to lower, will perhaps go to the Office of Best Practice, OPBR, it's easy, I'm getting used to the acronyms. They're currently looking at drafting up an RIS. That process started, as far as I know, formally 3 years ago. So anything to do with the regulations has to go through that process. It means that there is actually no encouragement for us to think outside what's called the deregulatory box. Even the Standings Committee on Chemicals, which drew up that spaghetti diagram and which has since been disbanded, their terms of reference were ultimately to reduce the regulatory burden. So it's a bit tough on people like SafeWork Australia to get anything done. I'd contend, and the Australian Council of Trade Unions has a policy around this saying that, look, our current approach is really fragmented. We actually don't assess on the inherent qualities of the chemicals or the carcinogens. We have anomalies all over the place. We don't talk to each other across the agencies. Poor old NICNAS will do a fantastic lot of work. It'll go across to SafeWork Australia, and because all the jurisdictions are there, because of the OPBR, changing something will take 5 to 10 years. I think it took us 20 years for silica. I've forgotten how many reviews. And it also creates, I think, because we focus in the wrong way, we don't have incentives for lots of industry to actually look at technological and technical advance. I suppose, really, does that all matter? Well, we'd say that it does, because this quote you could actually apply to carcinogens as well. It's really not, I think, that we should be talking about safer chemicals, creating sustainable industry so that we can actually live on a planet that will keep going for a while longer than what it currently is. According to Geyser, there is really a good way of looking at how to do our exposures as to have a systemic approach to banning or what we call toxic use reduction. We don't have that in this country. There's some examples that we've heard about at these sort of forums before, and also Canada and others, but we don't do it here. We don't prioritise our chemicals into tiers for action, although the recent work by NICNAS has been trying to do that. We have no systemic approach to transitioning from high risk to lower risk, and we have no public information available on what actually comes into the country, the volumes, what are used. And Geyser would say that that's actually the way to put your chemicals, and you can call that substances, including dusts or any other carcinogen. It's the same approach. I'm suggesting, and it's only a suggestion, that we need a system that prioritises and encourages avoidance and phase-outs of the use of carcinogens, that it links inside and outside of our work. It creates circumstances to diminish use and hence exposures. It coordinates and overviews, allows innovation and doesn't recreate the wheel. Now, I don't know what the solution is, but if you look around, there's some people who've suggested some things. The WHO Asturias Declaration in 2011 noted that you needed to work across sectors and agencies. Sorry, that was a declaration about occupational cancer that Terry was at. The Productivity Commission did acknowledge that perhaps we needed a central agency, but dismissed it as he said it would be too complex and unrealistic. But the UNEP, the same agency that has been trying to get chrysotile listed on the Rotterdam Convention, in their Global Chemical Outlook in September 2011, suggested that what you actually need is a focal agency that looks for information and coordination. It actually starts to focus on toxic chemical use reduction, and it starts to coordinate for consistent regulatory approaches and frameworks. I could go into each of the sort of minutiae of all of the different frameworks because I think that's actually really important, but I think that we need to actually stop looking down, which we've been doing for ages, stop looking through the lens of the Office of Best Practice Regulation and actually start looking at a way to reduce our carcinogen and chemical burden, actually look at a way that we can coordinate, we can create opportunities for good developments, for good sustainable industry in this country whilst decreasing our exposures. And until we get outside of our very narrow approach to what regulation does or doesn't do, I think we'll be stuck really where Mr. Pyatt says about what we do in terms of the chemical and carcinogen sector. It's a lot of money. Our chemical industry in this, the globe is actually equivalent to the German total economy. It's not a poor group of people. It's not a place where we don't have good minds who can do some good innovation. I think the challenge for us is to actually get out of seeing regulation and as a way to sort of, that it blocks things and actually start to open up and think in a different way about how we handle chemicals and carcinogens at work and in the community. Thanks.